Hi everyone, it's Fahim, pharmacy prescriber, contractor, founder of Medlearn. Very excited to have you all here today. I honestly can't wait to get this session started, and I'm sure within the next couple of minutes, we are going to be having a wonderful evening today, and we're going to be learning a lot. Now, you might be wondering, why am I so excited about these sessions that I deliver? Why do I really get so excited and really actually I start to get goosebumps when I deliver these sessions? And the reason is because the conversations that we're having today, the ideas that we're going to share today, everything that is about to happen in the next couple of moments is an opportunity for us all to work towards this vision that we have at Medlearn. And that vision of Medlearn is to have a world where everyone, it doesn't matter what you believe in, it doesn't matter about your race, your gender, but we all on this planet have access to amazing healthcare. And that is delivered by people like yourself who are inspired every single morning that they wake up to deliver this exceptional healthcare, and they come back fulfilled. And I want you to imagine what that world is like. Just close your eyes for a moment and imagine a world where we have everyone in this world has no issues with healthcare, from poverty to finances to being fulfilled and enjoying what they do. What does that world look like? Can you imagine the sort of people that you're with? Can you imagine your character? Can you imagine the skill set that you have? Honestly, the more I think about it, the more I feel like I'm getting these goosebumps, because this is something that is achievable. This is something that can happen and is not just a dream. It's something that can be made into reality, and that is if you and me together upskill ourselves and educate ourselves. Because when you educate yourselves, not only are you in a position to benefit financially, because you'll have the skill set, from opening up your private clinics, to offering value to GP practices, to offering services in a community pharmacy, to setting up your online clinics, everything is possible. So financially, you'll be well off. You'll be able to use those resources to make a difference to your lives, to your families, and to others. You'll also be helping our beloved NHS in solving this problem of improving access to healthcare. You're also going to be driving your profession forward. You're going to be moving in the direction that other professions are moving, like doctors, like nurses, like paramedics, like physicians associates. You can be the best version of yourself if you decide to educate yourself and you commit yourself to lifelong learning and improving. This is why we do what we do at Medlearn. For us, to have you being the best version of yourself, to you being inspired to do what you do, is what completes us and fulfills us here. This is why I'm stood here today and I'm sharing my message with you. So, from developing content that is student-centric, engaging, inspiring, to making sure that you can be the best versions of yourself, for me, that is working towards this vision, and that's what fulfills me. I look forward to having this session with you today. And remember one thing, if you're the best version of yourself, you can make a difference to everyone around you, and we can build a better world and leave it better than we found it. Thank you. Right. Good evening, everyone, and thank you very much for being here today. Just a quick test. Can somebody please just write on the chat that you can hear me and you can see me, everything is going well. So if you just write it on the chat, just quick, anybody who's there, just to confirm so we can get started. You can hear me and you can see me, and fantastic, brilliant, you can. I'm very fortunate today to have a wonderful team with me here today. We have Ahad, who's looking after the technical side of things, so I can just focus on what I enjoy. We've got a lovely patient here today who's assisting us as well, which is great. So I would like you to put your phones aside. I want you folks to really focus on what we're going to be going through today, because we are going to cover everything that you need to know in history taking step by step. So let me just get my slides prepared. There we go. And we've already discussed our vision at Medlearn with you folks. And I want you to literally, for the next 2 seconds, close your eyes and imagine a world where we did have this, where healthcare access was not a problem, where all of you were going to work every single day inspired. You woke up in the morning, you woke up with a smile, and you finished your work being fulfilled. Just imagine that world. And it's achievable. And I want you to hold that thought throughout this webinar and imagine what your life would be like if you woke up fulfilled every single day. And that is why we do what we do at Medlearn, and that is why we're here. So the learning outcomes today, pretty straightforward. I intend to cover everything, or as much as possible within this time frame, about history taking. I want to explain to you what is history taking. I want to explain to you why and how to take a history appropriately. I want you to understand the benefits of investing in yourself. And more importantly, I want you to leave here ready to learn and understand that learning is a lifelong process. Now, if you're here today and investing in yourself is not something that you believe in, and you'd rather invest in Bitcoin, then you need to leave right now. No, okay, stop. Did you invest in Bitcoin?
I did, yes.
Okay, so he shouldn't be leaving right now. If you have invested in Bitcoin, you don't have to leave. Take a seat. I do apologize. I take my words back. If you're investing in Bitcoin, there's nothing wrong in that. But you get the point. You get the point. I didn't know you invested in Bitcoin. We'll have a conversation later on. But you get the point. You must invest in yourself. There's nothing better than that. Now, I'd like to ask a couple of questions before we get right into this. So I'm just going to raise the first poll. And we're about to raise the first poll, which is going to be asking you some questions. And I'm going to give you 50 seconds to give this a try. So if we can launch the poll, and that's the first poll, it should be there for you now. If you're on your computers, if you're on your mobile devices, you should be able to give this a try. 50 seconds to answer these questions, and then we'll start working through. So there's nothing difficult on there. You can work your way through, and you should be able to answer them. So we're going to be going through this for 50 seconds, so don't rush. Give yourself an opportunity. You can do that. And I'm just going to go and have a look at the results and see how you folks are getting along. Just bear with me. Fantastic. So we've got another 30 seconds left. And the poll is there, so do please give it a chance. It should be there for you. And we can see that some are now starting to complete it. And we've got remaining 20 seconds to go on that poll itself. And I can see you're working your way through that. So there is no right and wrong as such. This is just to get you folks going and get that muscle that we have in the brain, get that engaging. So we're nearly done. We've got the remaining 5, 4. Oh, we've got around 10. It's all done. Yep. Right. Let's end the poll right now. And let's have a look at some of the questions that we have. So let me just share the results with you folks. Fantastic. So I'm not going to go through the results right now, but by the end of the webinar, we're going to go through them. And I'm sure you'll be able to answer them appropriately if you haven't. So thank you for all those who gave that a try. Fantastic. Let's get you guys woken up and let's start moving forward. So let's start moving with the next slide and let's cancel the poll. Thank you, Ahad. Right. So for those of you who stay till the end, we are going to be getting in touch with you folks and we're going to be giving you the structure step by step. This is the structure that you can use in your pharmacy. This is the structure that you could use if you're doing a consultation online or if you're in a GP practice, any setting. So you don't necessarily have to write everything down. Just enjoy the session. And if there's something important, make notes of it. But I will be giving you folks the structure step by step. So don't worry about it. Don't worry about it too much. Now, some of you may be wondering, why do I need to know this? Why do I need to learn how to take a history? And I don't want to dwell on this too much, but the role of the pharmacist is changing, and it is extremely important to make sure that we do it properly. I don't want any one of you folks to get yourself into this mess, whether it's lack of documentation, whether it's unsafe diagnosis. We don't want that. So let's do it properly, and let's make sure we do it right. And also because there's so much benefits of actually developing your clinical skills. Not only are you able to solve problems, and if you solve a problem, you're always going to be able to commercialize this and benefit financially. You can improve your finances by working in a GP practice, by giving them value. You can start working out of hours. You can set up your own private clinics. You could go to a community pharmacy and set up your clinics and offer a partnership model. But the world is at your feet if you develop yourself. And I'm a firm believer that the biggest investment you can make is in yourself. So please keep that in mind. And from a business perspective, this is just a very, very small point that we've highlighted at Amy's within my pharmacy business and the other branches that we have and the other pharmacies that we're linked with. And this is just an advantage that you could have if you could develop your clinical skills and invest in yourself. That are some of the advantages there. Because I'm a firm believer that we all here today and who's listening to this webinar should be financially well off. I'm a firm believer. I don't believe the root to all evil is having money. I think the root to all evil is lack of money. People will steal for money. People will fight for money. People will lie for money. So let's all of us benefit financially so we can wake up mentally relaxed and enjoy what we do. So develop yourself and let's start to enjoy life, and you can do it. But before we get into this, you can have a treadmill in your house. And we all know what the benefits of a treadmill are. But if you don't use the treadmill consistently, you're not going to get results. So just hold that thought. So what is history taking? Let's look at what is history taking. And all of you have undertaken a history before. There is nobody who is sat in this room. You haven't taken a history? No. Okay, so he thinks he hasn't taken a history, and we'll be getting into that in a moment, because if you've ever served a patient, or if you've ever attempted to solve a patient's problem who's presented to you with signs and symptoms, you have taken a history. It might not be a good history, it might not be in-depth history, but you've taken it. And all a history is you interviewing the patient. You acting as Pink Panther or Sherlock Holmes, gathering that information and trying to solve this problem that the patient presented to you with. Because the patient has presented to you with a sore throat, he's presented to you with an earache, he's presented to you with a tummy ache. It's now your responsibility to find out or solve what could be causing it. That is what you have to do. And remember, patients present with signs and symptoms. Patients do not present with a diagnosis. Life would be great if a patient was to present to you with, I've got tonsillitis, I'm suffering with a pneumonia, I have an ectopic pregnancy, I have bronchitis that's viral. Life would be great. You can then follow guidelines and treat appropriately, no problem. But that's not how patients present. If a patient was to present to you, or was to present to your chemist with tonsillitis, which one symptom would he present with? Fever. Fever, Pus. There you go. So patients present with signs and symptoms. Patients don't normally present with, I've got bacterial tonsillitis, I need phenoxymethylpenicillin 2-4 times a day for 10 days. Could you please write a prescription? That'll be brilliant. That'll be easy. That's not how they present. So we have to gather that information from the patient. And that is all a history is. And I want you to remember something. In order to reach a diagnosis, this is what you have to remember. If there's something that you're going to write down, write this down. I need to learn the signs, symptoms, or features of diseases. So let's talk about tonsillitis. For tonsillitis or any disease, you need to know the incidence, how common it is, how does age affect it, how does sex affect it, if it does, the geography, what the cause is, the etiology, the prognosis, the pathology, macroscopic and microscopic, so that is what you can see and what you can't see, the signs, symptoms, diagnosis, treatment, evidence, and prognosis. This is how you should know every single disease. And if you visit the CKS guidelines, you will see that they do it in a very similar way. They break it down in that structure. If you learn this for every single disease, you will then realize, hold on, for a sore throat, there could be tonsillitis, there could be referred pain, dental pain, there could be thrush, there could be an ulcer, there could be gourd, there could be a peritonsillar abscess. But I know the differences between these diseases. I understand that with tonsillitis, the patient will have maybe fever, maybe exudate or pus, absence of cough. But I understand if someone's got an abscess, then they're going to have difficulty, or they might have drooling, they may have difficulty, or very much difficult in swallowing. The dangly part, which is in the mouth, if you open your mouth and you go, you'll see that dangly part, the uvula, that'll be deviated. That is what you need to learn. Once you've learned that, then all you have to do is gather the information from the patient. That is it. So if for your, let's say, sore throat, you could list all your diseases, wonderful. For earache, you could list all your diseases. For abdominal pain, you could list all your diseases. For headache, you could list all your diseases, and you could compare and contrast. So, actually, all these diseases and earache, they all have an earache, but actually this disease has discharge, this disease causes fever, this disease causes pain at the mastoid bone. Then you can compare and contrast with the patient's story, and you now have your diagnosis. Does that make sense to everyone? I hope that makes sense to you. And certainly we can go through. That's what it is. You're gathering information. And which is more important? Is it the patient's story that's more important? Or is it what you can measure, the patient's temperature or the patient's pulse? Which information is more important, do you feel? Adnan, what do you think?
Patient's vitals.
So Adnan goes with vitals. What do you think? Do you think it's more important to know the patient's story or actually know their vitals?
Patient history.
Okay, patient history. Ahad, what are your thoughts?
History.
History. So we've got two people history. We've got one on vitals. If you want to write it down, write it down. I'm going to give you literally 10 seconds to see what your thoughts are. What is more important? Is it the patient's story, or is it you being able to measure and know his temperature, his pulse, his respiratory rate, and so on, that data? So is the subjective data information or objective data is more? Ahad, what have we got? What have we got there? People reply, what have we got there on the chat? If you can have a look, what are people saying? What do we have?
Both history.
Okay.
History.
What's the consensus overall?
Mostly history.
Okay, so it looks as if mostly history. And you're right. The reason is because, let me give you an example, and all of you in this room today. If you had a patient who presents to you with a fever, and that's the only information you have, can you do anything with this? It is difficult, because what's caused the fever? If I gave you a blank piece of paper and I said to you, here's a 20-year-old male patient with a fever. Go on. What's wrong with the patient? You're stuck. But if I told you it's a 20-year-old male patient who's got pain on swallowing, he's had the onset of these symptoms very soon, happen quick, he doesn't have a cough, and then you do an examination and you see the pus, what would you think it is? Tonsillitis. So that's why the patient story is very important. And it's important you gather the patient story in their words. Do not fabricate the story. Do not assume what the patient's saying. As they say, you write it down. So I hope that's been made clear to you on why the history is so important. And without taking a history, it is very difficult for you to reach a diagnosis. And also, Are we seeing more patients face to face, or are we seeing more patients on the internet, on the phone now with COVID? Online, online, online. So how important is how important is it for you to gather that information from the patient more than ever? The history is even more important now because now you're not going to be able to examine the patient. Everything is based on you knowing, right, I know the classical signs and symptoms. I know them. I can compare and contrast with other diseases. I can now reach my diagnosis. So this is even more important now to make sure that you can do this properly and a structure. Folks, you have to have a structure. It is impossible without having a structure. And let me give you an example. Any of you here who are boxing fans, or cricket players, or footballers, when they're going, you're a fan of? Sorry? All of them. I was a fan of all of them. And I'll give you an example of Floyd Mayweather. And for all of you who know who Floyd is, an amazing boxer. When the going gets tough, what does he go back to? Basics. His basics, his fundamentals, his structure. If you ever watch Floyd box, or you want to see a masterclass in basics, watch Floyd. If you want to see a masterclass in football, have a look at maybe someone like Ronaldo or Messi. If you want to see a masterclass in diagnosis of disease, have a look at someone who follows a structure every time they won't get it wrong. Just ask yourself, when you have done a mistake in your pharmacy, a dispensing error, what did you not follow? What did you not follow if you've ever made a mistake?
The procedure.
The procedure, structure. Anytime that I've made a mistake, it's always been, I never followed my procedure. I never followed my structure, and that's where you get yourself in trouble. So structure is important, and consistency is important, and that is what we're going to go through now. So I hope now, a quick summary, you understand the importance of taking a history. You understand the importance of making sure that you can follow this structure, and you understand the benefits of a history as well. Is history taking a science from art? Personally, I'd say it's a bit of both. I'd say history taking is a science, is an art, it's a bit of both. I don't feel it's one or the other, but I think you certainly can learn the science, and then with time you can develop the art. And I'm a firm believer in I can't do it. I don't agree with that. I say I can't do it yet. Anything can be learned, anything can be taught, anything you can do. You may not become Lionel Messi or Cristiano Ronaldo, but who knows if you're not better than them. That's how I see it. So anything can be learned. You can learn this as well with practice. So how do we start? As a general rule, I've listed some points here. That your clinical diagnosis from when you see a patient, so the moment you set your eyes on a patient, your brain has to start to work. What do I mean by this? If I have a patient who sat in the chair here, let's have a look at Adnan right now. The moment I go out to see Adnan, I am now looking to see, okay, is there anything that I can see that says that this person may be unwell? Yeah. Does he look unwell? Does he look that this person is in some sort of distress? Imagine if you were having a heart attack, how would you stand? How would you sit? Yeah, some sort of heart, you'd be maybe clenching the fist or maybe profusely sweating. Remember your time when you've been unwell. So that's the first thing I do. As soon as I walk out to see my patients, the first thing I do is I observe. I start to observe. And I was taught by my wonderful wife, and what she said to me, in order to become very good at observation, go to a museum and have a friend and look at a picture and go back to your friend and describe that picture, see if they can find it. That is how you become good at observation. Let me explain it again. We're in this room together. And if I was to look at something, let's say I was to describe the camera. Without using the word camera, I have to explain that to you and describe it so well that you could go anywhere in the room and you could say, that's the object you're talking about. That is what you have to develop when you're talking and looking at a patient. Your observation skills have to be great. For example, let's say I'm talking to Adnan and Adnan refuses to make eye contact. Maybe it's cultural, or maybe there's an issue there where he's feeling uncomfortable. You have to observe. Let's say, for example, it is freezing cold today and Adnan was sat here and it would be quite funny actually, and he was sat in shorts. Whether he's extremely warm or something's not right, or maybe suffering with a thyroid problem, God forbid. So observation is very, very important. That's what I do from the start. Let's say you've got a patient who's got back pain, and the way they get up like this and they're walking, you can sense, okay, something's not right. And you might know that there are some clinicians who still walk out and say, Mr. Ahmed, because they want to see the patient walk. You may have noticed that some doctors will still walk out the room and say, Mr. Ahmed, and they will look and they'll see your walk and say, okay. And they're making this is why they're making the observation. How are you stood? How are you sat? Right now, everyone in this room, nobody looks unwell to me. So that is extremely important for you. I'm just going to have a look at the slide. Right, okay, so we've got that. So observation is the first thing. We've got observation, we've got inspection, and we're going to build on this. I don't want to go too much on the physical examination. I want to get right into the history. So let's just start off with the observation. That's the first part. Now the history taking structure. Do you remember your time when you were writing an essay, what they told you? You have an introduction, you have the body, you have the summary, and you have the end. It's exactly the same here. It is exactly the same here. We have the same. When you do a consultation with a patient or any conversation you have to have a structure in place. You have to understand, right, I'm going to spend this much time with this patient. What is the outcome of this meeting? You have to structure it. So overall, you have the same concepts here as we have a structure. We have the same structure here. And my colleague is getting bored. We're going to start to utilize him in a moment. Don't worry. We're going to start to utilize him so he doesn't have to yawn. He doesn't have to yawn. We're going to utilize him in a moment. Just hang in there tight. Hang in there tight. So as I was saying, that there has to be a structure. And that's where you have a beginning. Active listening. This is something I'm learning. Because I know that sometimes I can talk and get my point across, but don't listen. You have to listen. And active listening is where you ask a question and you're waiting to get that information, what you're looking for. This is active listening. There's one thing listening, where you're listening, and there isn't actually a reason as to why. There's one thing where you ask a question and you're trying to get the information. This is active listening. And we normally do this by offering or asking open-ended questions. Because let's say we had Adnan here today acting as a patient, and I said to him, did you enjoy your day today? Yes. Conversation over. Yes. You've given him a closed question, yes or no? Instead, if I ask, how did your day go today?
They went well.
So he said it went well, but he's being awkward now. I'll tell you that now. But I can certainly prolong that conversation. The point is that you're going to ask questions to get a response. And you don't want to leave closed questions. You don't want to ask closed questions. Have you enjoyed the webinar? Yes or no? That's not beneficial for me. Can you tell me where I can improve in this webinar? Can you tell me how we can better the service that we offer? Because you can't answer that with yes or no now. So we're going to start to go through this step by step. We then gather the information from the patient, and we then start to put this into context, and then we start to reach our diagnosis. So let's get right into this. This is the structure. The first thing that I always do, and now if you want to write it down, you're more than welcome, is I always have an introduction. And in my introduction, I introduce myself to the patient. So let's say the patient's sat down and I was sat down, and we may not have too much time to explain the seating arrangement, but I just want to mention that it is important how you sit. Please make sure you respect your patients, and please make sure that you sit appropriately, where your legs are not too wide open. So it's important to make sure that you have the right seating arrangements, and in future webinars, we will go through this on how we can do this appropriately. But let's get into this. So I'll introduce myself. Hello, my name is Fahim. I'm the prescribing pharmacist here today. So I've given my name, I've given my title. He needs to know your designation. Are you a pharmacist? Are you a nurse? Are you a doctor? Who is he speaking to? The patient has a right to know this, and that's how I start. After that, I want to gather the information. I want the patient's full name, address, date of birth, contact number, gender. You want to gather as telephone number, as much as information as you can. And yes, it is true that you can fill all this information out before. You can give a form and your patient can do it to save time, but you need that information. And I will ask, sir, can I please confirm your first name and last name? And can I please confirm your title? How do you class yourself, male or female? Can I confirm the first line of your address? And then you'll go through postcode, you'll go through contact number, and so on. I cannot stress this enough. Because when you're diagnosing and treating patients and you need to get hold of the patient and you've got the wrong number or the wrong address, believe me, you're going to have sleepless nights. Believe me, because you were the last person that patient saw. So you need to get hold of the patient. Maybe there's a problem, or you've changed your mind, or you've got second opinion. You need to get that information. So that's the first thing you do. So I've started off with my introduction. I've asked the patient's name, address, contact number, date of birth, verify the age, gender. Again, that's very important as well. Mobile contact number. And then I'd like to ask my patient, how would you like to be addressed today? Mr. Ahmed. Right. Now what I want to do is I want to explain the importance of confidentiality and if this patient would like a chaperone, somebody to be present in the room. So any conversation that we're having today, Mr. Ahmed, is confidential in line with our policy. Make sure you have a policy. And is that okay with you? We may have to send some information off to your GP. Is that okay with you as well? And again, continuity of care is extremely important. Now, let's say, for example, I treat this patient with a urinary tract infection. I don't let the GP know. This patient visits the GP, forgets to tell the GP that he's already had treatment, the GP re-prescribes. You can see the problems. So continuity of care is very, very important. And if you have a look at the CQC points, they mention this about continuity of care. Very important. So we've mentioned chaperone. We mentioned confidentiality. He is happy. I now want to ensure that my patient understands the structure. And let me explain how we're going to do this. Mr. Ahmed, I'm going to be undertaking a consultation with yourself. We're also going to be asking some questions. And this may also involve me doing a physical examination. Is that okay with you today? So he understands this now. We've made it very clear from the outset, what are we about to do? And one other thing I'd like to mention is from time to time, I might be making some notes. So please don't feel that I'm ignoring you. So that way, if you are making notes and you're writing down, he doesn't feel he's being ignored. And also, when you are undertaking consultations on Zoom or on Skype, you have to look at the camera, please, not at your laptop. My laptop is there. If I'm looking at the laptop, I'm not looking at you. Look at the camera, because the way we consult, everything has changed now. I'm quite lucky and fortunate that Adnan is here, but if it was being done on Zoom, like I can't see you now, in order for me to maintain that communication, in order for me to make sure that we are gathering that information, I have to look at the lens. So you have to practice this. Very, very important. Initially, what I want to start with, and I want to break down this structure, we have a presenting complaint, and all a presenting complaint is the summary of your patient's story. That is a presenting complaint. Think of a presenting complaint as when you read a newspaper, the headline story. So this is a 27-year-old male patient who presents with earache, sore throat for the last 5 days. A brief summary, a sentence. That is a presenting complaint. We then have the history of the presenting complaint. And this is the history of the presenting complaint, is where you're going to start to gather information from the patient. And we're going to go through that in a moment. Now, when you have your presenting complaint, at that point, you should be able to know some common diseases that cause those symptoms. What do I mean by this? If I have a patient who has right upper quadrant pain. I should know. Could be liver problem. Could be basal pneumonia. Could be problem with could be gallstones. Could be cholangitis. Could be cholecystitis. It could be something to do with with the liver or the gallbladder. If I have a patient who has right lower quadrant pain or pain in the right iliac fossa, I should know it could be an ectopic pregnancy. It could be appendicitis. It could be pelvic inflammatory disease. You have to know your diseases, because if you don't know your diseases, then the next process becomes difficult. Because otherwise, all you're doing is asking a set of questions. So the moment he mentions to me, I have earache, or I have sore throat, or I have abdominal pain, that's whatever it might be, or I have shortness of breath, I have to know my diseases. So I can start to then ask the relevant questions. Very important. And you'll find experienced clinicians are able to match symptoms together like this. And this is what I find, having taught hundreds of students, where they go wrong, is that they understand or start to learn a structure, but they can't relate to it. And I'll give you an example. It happens all the time. I'll have a student, I'll say take a history, and one of the questions will be menstrual cycle. And they will ask the male, when did you last have your periods? Because they're not thinking, they're following the structure. And he will look at you and say, right, are we in the right seats? Initially, learn your structure, then you have to apply the structure. For example, a sexual history. If this person has, let's say a sore throat, and it was blatantly, there was no link to a sexual history, me diving into the sexual history is pointless. Not only are you wasting time, but you're not efficient. And the patient might lose trust. That why is he asking these questions? I don't feel comfortable. What's there for him to know this? So as much as you're going to learn a structure today, you are also going to start to develop the application of this. So I want you to get a pen and paper right now. I want you to put at the top PC, presenting complaint, underline it. After that, I want you to write the history, HPC, history of presenting complaint, underline it. And let's do this. So, sir, how is it I can help you today?
I've got a sore throat.
Right, this is beautiful. Absolutely beautiful. Why? Because instead of got a sore throat, he's gone silent. I love this. Because we need to get used to silence. And you noticed I stopped for 5 seconds. If you've got a sore throat and you want to sit there quietly, no problem. I'm not scared of silence. We can sit there quiet as long as you want to sit there quiet. We can do this all day. I'm going to give you opportunity. If he's not going to speak after 5 seconds, I'm going to say, could you tell me a bit more about this sore throat? I'm not going to rush into the questions. You know what? I was reading a book by Brian Tracy. Absolutely love it. And it was about sales. And what the book talks about is very, very important to listen to this. The book says that when you are speaking, you are not selling. When you are speaking, you are not selling. When the spotlight is on him, that is when you are selling. Imagine we're in a closed room and it's dark. Who do you want the spotlight to be on? I want the spotlight to be on him, because I want to investigate him. I don't want him to investigate me. If I'm not asking the right questions, I'm not in control of the conversation. You have to understand this. This is a conversation. I'm controlling the conversation here right now, because I'm asking him the questions and it's all about him. So if we do go silent, I will say, would you tell me a bit more about this sore throat, please?
I've had it for about 3 days now.
Yeah.
I struggled with drinking water.
Sure.
As well.
And is there anything else you'd like to mention?
There was a cough as well.
Okay, so you can write this down. It's been going on for 3 days. There's a bit of a cough as well, and struggling swallowing as well. I like to always summarize. So can I just confirm? So you've had this sore throat for 3 days.
Yeah.
You've had a cough.
Yeah.
And you're struggling to swallow. Fantastic. So you're understanding that you're making sure you've got the right information, and this becomes very, very important, especially when you're doing a telephone consultation or you're doing a consultation on online. That did you hear right? Because sometimes the internet stops, it cuts. What do? You can't assume. So I get that information. I'm gonna summarize. Right. After this, once your patients had the opportunity to express themselves, we now directly go into the history of presenting complaint. And this is only possible if you can list the diseases. If you can't list the diseases, why, for example, let me give you an acronym. For the history of presenting complaint, we go through old CART. So we ask for onset, location, duration, character, associated symptoms, aggravating factors, relieving and treatment. But these questions are only beneficial if you understand why you're asking. And I always ask my students this question: why do you want to ask him the onset of the disease? Why do you want to ask him the location? Because if you can't answer that question, the trap that you're falling for is you're just asking questions, and a 5-year-old can do that. Application, folks, application. How are you applying this? So let's look at a sore throat. If I was going to ask for onset, the reason I want to know about onset is because I want to classify this sore throat. Is it a chronic sore throat? Is it an acute sore throat? Because if the sore throat has gone on for longer than, let's say, a couple of weeks, then it's now going chronic. And the causes of a chronic sore throat are different from somebody who's got an acute sore throat. A chronic sore throat could be something like a cancer. So onset is important. Location in this case is important because if this individual is suffering with infectious mononuclear sclerosis, I want to know that where is the sore throat? Is it, and I don't want to get into too much science, but is it at this part of the throat itself or the neck, where we call the anterior cervical chain and so on? Is it the posterior? I want to know that. Again, onset, duration together, character. Now, I don't like character. I'm not a fan of character because the textbooks will teach you, ask the patient, is it a stabbing pain? When did you last get stabbed?
I haven't been stabbed yet.
So how can you ask a patient, is it a stabbing pain? I get the point behind it, but the books will say, is it a shooting pain? When did you last get shot? But I understand the concept why they are. So I think a good question for character, is it a burning pain? Because nerve pain is associated with burning and people can relate to that. But when you ask a patient, oh, does it feel like you've been shot? And he stood there thinking, I've never been shot. I don't know what it feels like. Oh, is it a stabbing pain? And he's like, right. When did I last get stabbed? I mean, do you get stabbed? Is it normal? So the books will teach you, is it a stabbing pain? Is it a shooting pain? Is it a burning pain? But I think what is relevant is it a burning pain? Is it constant? And is it there all the time? Or does it come and go? Because I'll give you an example. If you have a kidney stone, kidney stones tend to cause more pain the moment you start to move because the stone will move. It's relevant because it's relevant to ask that question. So I know if I have a patient who's got, let's say he was to present to us with bleeding in the urine, and one of my differentials was a kidney stone or nephrolithiasis, as they say, I know that the character will be important. That does this pain, is it a shooting pain that starts maybe at the right lower quadrant and shoots up? And does it get worse when you move? Because that is normal if a patient has a stone and stone can move. This is where it becomes, again, folks, what I'm teaching you today is I'm giving you an understanding of how much deep this is. There's more to it than what I'm going to teach you in an hour, but you must appreciate that there is a way that you can do this. But I'm just getting the point you have to apply. Do not become a one-trick pony. Because when you become a one-trick pony, that is where you will struggle. So not a one-trick pony. So every time I will ask onset, location, duration, character, why do I care about these questions? And how will you know this? Is if you know the diseases, then you know actually a tonsillitis, this person would have a burning pain. It makes sense. You can ask the question then. I need to ask that question. Let's say sore throat. And Teja, if you have a patient who has sore throat that is caused by reflux, what will they tell you they have? Yeah, acidity. They will tell you actually, I get this burning feeling and it burns my mouth. And I get this sore throat. Makes sense? Because you know the diseases, you know what you're going to ask. Makes sense, so you have to know this. So Let's go up now. Let's just ask the onset. Sir, when did this start?
3 days ago.
3 days ago. Whereabouts is the pain? Can you just show me?
Stayed back in the floor.
Fantastic. Is it anywhere else in the throat?
No.
No? So, and it's been going on constantly for 3 days?
On and off.
On and off, that's fine. Do you have any other symptoms other than sore throat?
Just the cough.
Brilliant. Now this is absolutely beautiful. And you might wonder why that is. Because, okay, somebody tell me this right now on the chat. If you have a patient who's got a sore throat and he's got a cough, which is it likely or unlikely that he has a bacterial sore throat? Write it down. If this patient, I'm just going to get some water. If this patient has a cough, is it likely that he's got a bacterial sore throat? Yes or no? Ahad, what are we getting? What are people saying?
Unlikely.
In actual fact, we can close the webinar right now because he just made it so easy for us. But absolutely, you need to know this. And it's very important for you to know this. And there you go. But let's say he doesn't have that. Let's say he says to you, actually, for you, I've got a sore throat, but also I can't swallow. I can't swallow. That is concerning for me. And I will verify that by asking him, if I was to give you a glass of water, can you swallow that? Hopefully he says, yes, I can. And what he was trying to say is pain on swallowing. And I want you to write this down. Pain on swallowing, folks, is known as odonophagia. The difficulty or the act where you cannot swallow is known as dysphagia. They're two different things. Dysphagia versus odonophagia. And we take it for granted. But swallowing is such a complex process. It is unbelievable. You have no idea. Just because you can do this, everything is happening automatically. Imagine a world where you have to tell your brain that I need to swallow and all the muscles have to contract. Imagine a world where if you didn't tell your brain you have to breathe out, what would happen? Imagine I'm talking, I forgot to breathe. Can you imagine? Oh wait, let me breathe. So it is important that while we're here, and I might be going off a tangent slightly, that we should be very much lucky for what health we have. And if God has given you, whatever you believe in, has given you the skill to learn and diagnose, we should be the best versions of ourselves. But anyway, back to the point. So this particular individual here has said to you that he's got a cough, that's fine. Is there anything that makes it better for you?
Drinking warm water.
Warm water. And I'd like to mention something here. Please don't ask your patients two questions at the same time. Don't say to him, is there anything that makes it better or worse? He'll say drinking warm water. What was he answering to? Was he answering to better? Was he answering to worse? And I've seen students do that. They say, oh, what makes it better or worse? Talking. Okay, does talking make it better or worse? You've given him two choices, so be careful what you're asking. And something so important, folks, something so important, vitals. And I'm going to get to vitals in a moment. Mr. Ahmed, have you tried any treatment before you've come to me today? Right. Let's say you took paracetamol half an hour before. If I was to measure his temperature right now and he took paracetamol, can someone tell me, would the temperature go up or could it be down if he had a fever? If he's taking paracetamol? Teja, what do you think? Adnan? Ahad?
Down.
And this is so important because you may have a patient who you may measure the vitals and think, oh, you don't have a fever. But actually, he took the paracetamol 20 minutes before he saw you. He does have a fever. And guess what? He does feel warm. You've not realized that. You've got a patient who presents to you who has asthma and they take salbutamol or they take a medication that causes the heart to flutter or race. You've not made the link. And you're a pharmacist. If you are, that means you're an expert in medicines. So we've gathered that information. You've written it down. Now we're going to go on to the other steps. After this, you can go into anything you want. You can go into past medical history. And again, the reason why you're gathering this information is because you want to link this to the disease. For example, let's say you have a patient who has right iliac fossa or pain in the right lower region, and in the past medical history, this person tells you, I've had an ectopic pregnancy. What do you think that's a risk factor for? Write it on the chat. You've got a patient who has right lower quadrant pain, and in the past medical history, she tells you, I've had an ectopic pregnancy. What is that a risk factor for? What else do you think that's another risk factor for an ectopic pregnancy? Yes or no?
Yes.
Absolutely. Let's say you have a patient, and again, you've got a patient, and he's got, again, risk factors, folks. Very, very important. So, any sort of past medical history, sir?
Just asthmatic.
Asthmatic. And I'd like to ask them, I will have a list. You know, is it diabetes, cholesterol, asthma? Make a list. And there's various different acronyms that you can use. Various different ones you'll find on the internet. Get that information. What's his past medical history? Also, because if you're going to prescribe, this is going to become relevant. If you've got a patient who's got a heart problem and you're prescribing them a beta blocker and so on, you need to make sure that you know that. So past medical history. Always ask about surgical history as well. It might be relevant. After this, you can go into the family history. And again, for the family history, I want to find out that does Mr. Ahmed, is there anybody else in the family who's suffering with the upper respiratory tract infection? Why do I want to know this? Why would I be interested to see, Adnan, is there anybody else in your family who's suffering with a cough or a cold or has any sort of... No. And you can write it on the chat, but I'm sure you've made the link. The reason why you need to know this is, again, risk factors. Maybe this is where he's got it from. Where did he get this sore throat from? That's somebody in the family. So the family history is important. Also, again, for risk factors, let's say you've got a patient who presents to you with chest pain, or says you've got pain here, and he tells you, my mother, my father, my brother, they've all had heart attacks. What do you think? And he stood in front of you right now, and he says, and he's telling you, I've got chest pain. Do you really think that he's going to be having indigestion? He just told you that the entire family has had a heart attack. So you need to make that link. Very important. Very important. So if you're going to be dispensing that Gaviscon or prescribing that Gaviscon over the counter, think once more. Okay? So that's important. And we're just going to go on to the next slide. Right, social history. The social history is all about finding out about Mr. Ahmed's occupation, his general, his economic status, for example, because we know that money work is linked with morbidity, mortality. We know this. It's linked with mental health. We know this. Of course, so you need to find out what's his occupation. Does he smoke? What about alcohol? All those status questions. Again, you can do this by giving the form beforehand and gather the information. You don't have to do this face to face. Get the information and verify occupation, smoking, alcohol, what they do for work, what they do for living, what's their housing like. Let's say you've got a patient who's recently been diagnosed with dementia and she goes, I live all alone. That's a problem. That's a problem. You need to look at this. Let's say you've got a child or a patient who has diabetes, he's got nobody to care for him. The problem. You've got to know about this. Drug history. And I cannot stress this enough. If you do not ask your patient about allergies to foods, medicines, you're going to get yourself in big trouble. Allergies to medicines is important, to foods is important. Also, if I do ask for a drug history, now let's say Mr. Ahmed mentioned to us, did you say you're taking Ventolin, salbutamol?
Yeah, asthmatic.
He's asthmatic. Let's say he said, I'm taking the inhaler. There's an opportunity for you to gather that information. The inhaler that he's taking, is it working for him? Is his asthma controlled? Again, every opportunity counts. When you give value to patients, when you give value and you solve problems, things become easy after that. So again, drug history is important. Travel history is important. Not with every disease, but some diseases. It's important. Let's say somebody presents to you with fever, temperature, night sweats, recently had presented from India maybe, or has come from Pakistan or from Africa, malaria, dengue virus. You need to know this. TB, very important. Sexual history. And again, a sexual history becomes important depending on the disease. If it's a urinary tract infection, you need to know, is this person, could it be an STI? Again, very, very important to make sure that you understand the importance of a sexual history. Very, very important. And we're not going to go into that. But again, if I was to go into a sexual history, I would say to Mr. Ahmed, I'm going to have to ask some personal questions because of the information that you've told me. I need to gather some more information. Is that okay for you? And again, I'm asking the patient. I'm going to ask some personal questions, folks. And you need to keep a straight face. If I start smiling, giggling, I'm going to ask some questions about your sexual history. We ain't got time for that. We don't have time for that. We don't have time for that. Get to the point, get the question, get out. So when I first started, I would giggle. I wouldn't know where to start. How do I ask? What sort of sex do you practice? But you need to get to the point, and it comes to practice. Once you've done it again and again, and if you're awkward, if I come across awkward, how will you come across? Awkward. You can tell. If I'm, again, communication skills. If I come across awkward or I come across in any way uncomfortable, you are giving that energy to this gentleman. And he won't open up. Now, to end this is absolutely beautiful. And that is your review of systems. This has saved me so many times. I will go through this every single time, and that's review of systems. I will go through this, and I will start with the head, and I'll say, right, Mr. Ahmed, do you have any pain in the eyes? Any loss of vision? Any blurred vision? Right, I'm looking at the eyes. I'm now going to go to the nose. I'm going to say, right, Mr. Ahmed, any runny nose? No. Any, do you feel the nose is stuffy or blocked? Okay, fantastic. So I've done the eyes, I've done the nose. I go to the ear. Any sort of pain in the ear? Any loss of hearing? A bit of loss of hearing. Okay, now if he mentions a bit of loss of hearing, you have to go back to the history all over again. And we're not going to do that. If this is what he wants, we're not going there. I know that's what he wants, we're not doing that. But if he said that, once the patient mentions something to you, you have to address the issue. You cannot ignore that. Because you need to document that, and he mentioned it to you, you didn't know anything about it. So we have that. After that, what we're going to do, we've done now. What I would say is, because we're dealing with a sore throat, I wouldn't ask him, do you have a sore throat? He just told he's got a sore throat. So what do I mean? If you have a patient who's got a presenting complaint with the eye, you miss out the eye. You got nose, you got ears, you got throat. If he's got an ear problem, you don't ask about the ear because you investigated that. Afterwards, I'm going to work down. I'm going to go to the respiratory system. Any shortness of breath? Any chest pain? Do you feel that your heart is beating faster? Again, make your way down. After that, what do we have? We can go to the abdomen. And we can ask, do you have any abdominal pain? No. Have you urinated? Have you been to the toilet? Yes. Have you passed your stools? Yes. Again, important. Abdominal pain. And you can go in a bit more. Again, a set of questions, folks. You may also want to ask, has there been any sort of recent weight loss or weight gain? Because again, the sore throat and other features, it's important. So working down, urination, we've asked that. Do you have any sort of pain or urination? You passed stools, we've done that. I want to mention something very important about females, menstrual history. There are so many cases that patients have been misdiagnosed because they have not picked up an ectopic pregnancy. If you have a patient who presents to you with abdominal pain, and this patient is of childbearing age, and you feel that there could be risk that this patient is pregnant, what can you do in your pharmacy setting then and there? Pregnancy test. No rocket science, do a pregnancy test. Do not take it lightly. So menstrual history for females, absolutely. And if anyone's taking a history from a female patient and doesn't ask for the menstrual history, that's potentially a fail. Okay? So we've done the head, we've done the ears, we've done the nose, we've done the throat, we've done the respiratory, we've done the abdomen. You can then go on to dermatology, any rashes, lumps, bumps. Is there anything unusual that you've seen? You can then go on to the central nervous system and say any headaches, any psychiatric issues. You can cover the entire body systems by doing this. Musculoskeletal, any aches, pains, back pain. Then you close the conversation from there. So to summarize, the history will help you gather your information, diagnose and treat patients. You follow a structure. You have your introduction, gather the information from the patient, explain what you're about to do. You have a presenting complaint, history of presenting complaint, past medical history, social history, drug history, travel history, surgical history, sexual history, menstrual history, review systems. We've been through this. And you document all this, and now you're in a wonderful position. And for me, I'd like to take some questions now. That is all for me now. And at this point, I'm absolutely happy to take any questions that you have. So if you've got any questions, write them at the chat. And actually, I want to do a quick poll. Can you release just a quick poll now? I'd just like to do, if you do the Medlin webinar choices, if you do this poll first, I'd like you to before we get into questions, please have a go at this poll. We want to make these sessions valuable for you, and we'd like you to give this a try. Which webinar would you like us to do next? Which one would you like us to do? And I've put down a set of points there. Before we go into a Q&A, I'd like to just go through this. Which webinar would you like us to do? So we can essentially make sure that we are doing what you folks need. I can talk all day. This is what I love. This is what I do. So I can do it. So I need you to know which one would you want to do. Let's have a look what we have.
Online.
Right, so we can see. So there's plenty of webinars. Keep answering, folks, because the more you answer, the better we can do these webinars and make them valuable for you. Because I don't know what you need. I certainly would love to find out what your problems are, but I need to find out. So, well, let's give it another couple of seconds. What do we have? Right, I think we've got 27. Folks, that's 44 of you. Please answer this webinar. It's going to give us an opportunity to make it perfect for you. I'm going to give you up to another minute. Please answer as much as you can. I'd really appreciate this. Come on, come on. Don't be shy. There's 20, there's 40, there's 44 plus people here today. There is no way that you folks can answer that question. We want to make it valuable for you. Answer that question. Which webinar would you like us to do next? Please write it down. I'm going to count we're going to count for the next 30 seconds. Some of you, so half of you have done it. Let's keep doing it. We're going further so we can get into the Q&A. Fantastic. Brilliant. Keep going. We're nearly there. We've got 31. We're getting there. You people are so shy. Just do. I love it because you've got all that knowledge. It's mind-blowing. Where are we now?
32.
Right. We've got 33. I'm going to count till 10. And then we're going to end this. 1, 2, 3, 4, 5, 6, 7. Take a screenshot so we know. Take a screenshot so we know. If I do this for you, 1 second. Brilliant. Right. And end the poll. Let's have a look what you voted for. And what do we have the most of? Share the results. Right. So it seems to be, Ahad, what do we have?
Walking clinic.
So walk-in clinic seems to be the main one. How to set up an online walk-in clinic. That seems to be the one. So we've got how to set up an online walk-in clinic. We also have on there how to develop my clinical skills, which is next. And then we've got working in a GP practice. That's brilliant. And, I purposely put these questions up on how to make money as a pharmacist. Well, I was voting for that one, actually. But right, Ahad, answer any questions. Right, folks, I'm going to stay here for the next 5 minutes. Let's answer some questions that you have. And what do we have, Ahad, on there? Let's have a look. If you can. Right, what are the questions we have?
Can you resend?
Right, so we have, how do we use our skill set abroad in the private sector as a pharmacist? Very, very good question. Well, how to use it abroad is the same way as how we use it here. Now, when you're abroad, this is where you have to start to influence policy. Now, in the UK, I just want to briefly mention this. Before we could become prescribers, nurses, hats off to them, did a fantastic job at influencing policy. So if you're abroad, develop your clinical skills, start to get your teams building up, show those people who make policy value, and the same thing that's happening here, you can do abroad. And remember, you don't have to prescribe. You could do what we call functional medicine, where we're talking about taking a holistic approach. You could talk about weight loss, nutrition. You don't have to prescribe. There's so much you can do. So plenty of benefits that are there. What else do we have?
What webinar or different diagnosis?
Right. Looks like there's no other questions. So we're going to be getting in touch. Oh, we got a question. What's the question? Read it out.
Knowing the diseases, any sources, materials to help on this?
Right. Prince, thank you very much. Very, very good question. The question is, how can I get better at this? There are plenty of ways that you can do this. What I found is that the literature out there is broad. So it took me 4 to 5 years to develop my clinical skills. but I did it the long way. And this is why at MedLearn, we've developed content that makes life easier for you so you don't have to spend 4 years like I did. Because there are a lot of books. You could go pick up any book on internal medicine, 4,000 pages will tell you everything. Do you have the time to go through it? And that's exactly the same thing that you told me, time. Time is money. So if you're going to be spending 4 years, you can, but you pick up any book on history taking, MacLeod's or Bates, they're hundreds and hundreds of pages. You can do it, but it takes time. So we will be getting in touch and showing you how to do this and develop your skill set. Absolutely. You can do it on your own, but it takes a lot longer. That's the difference. What else do we have?
Any good recommendation, clinical trades tools? Right.
Right. Let me use this. So Pura Patel said, how long does it take to complete your highest level package? I'm not sure what that is. How long does it take to complete your highest? Okay, how long does it take? Well, we work with you until you get it right. For us, it's not how long does it take, it's how much time can you invest in yourself. And I would say to all my colleagues and students is consistency, half an hour a day. And you can complete this in 6 months to 1 year to 2 years. Why? Because do you have the time?
And are you safe?
And are you safe? Absolutely. Thank you. Are you safe? So it's not about completing, it's about developing your skills. I would say, if you were to ask me honestly, I say at least a year. Why? Not because you can't do it, because can you dedicate 40 hours a week to learning all day? Is it possible? If you can do it. How long would you say, Faisal, if you could do it 40 hours a day? I think in probably 40 hours a day, if you wish. If you were to do 40 hours a week, I think in 6 months you could finish it, maybe less. But we're not students anymore. 30 minutes a day, I'll say a year. 1 year.
Do you want a private course who wants to know more?
Do you have any private courses for who want to learn more? Absolutely. We do. Ray, thank you for that question. We have a range of courses to help you from developing your clinical skills, from helping you to develop your business skills to set up a clinic, from helping you to work in a GP practice, learn chronic diseases. We cover everything from start to finish. So you don't have to spend hours doing this, and we guide you through, because for us, you being the best version of yourself, that's all we want. Absolutely. Yes, Samia, we can certainly have a chat. Sorry to you, we can certainly get in touch, Samia. We can discuss this about UAE. Brilliant, we can do this. Aisha, you know what? I have to say this. This is one of my colleagues, Aisha, and she is absolutely, amazing. And she's absolutely right. And she said it's not a race. And every time she comes on, I say the same thing. She's one of our students at MedLearn, and I'm inspired by this girl because she shares a very common vision to what I share, and she's right. It's not a race to finish it. Remember, learning is a lifelong process. Better yourself every day. Right. Well, we've got loads of questions. Okay, another question that we have is, what are the prices for the courses itself? So the courses start from, our basic course starts at £200 a month. And that's for the first year. And then after that's £30 a month. What you get access to, you have your own personal mentor who guides you. You get access to content that is designed for you. And we ensure that you can utilize your skill. And I will say this categorically today. We offer a better than money back guarantee. We've never had, out of the 600 students on our courses, we've never had a single student who said, okay, I'll have my money back. That's how confident we are. Any course that you take, if you don't get results, you can have your money back. And I can say that on record. Absolutely. Because this works. So for us, we're giving you value so you can make a difference. So yes, from £200 a month, you can develop your skill set. You can do what I'm doing in less than 4 years. Absolutely, you can. And there's another question that says, if I want to set up my clinic, can we help you? Yes, we do a franchise model where we can help you set it up, from CQC registration, from giving you SOPs, from teaching you the entrepreneurial mindset. We go through everything step by step. But I want to say something. If you don't invest in your teams, you cannot do this, folks. You have to invest in your teams. Today, I had Adnan, Teja, Ahad. Why? Because they're my team. Without them, it's impossible. I understand the importance of investing in my team. You must understand this. And anybody who's got a team, we work with your teams. So absolutely, we can do that.
We have, right, okay, brilliant. Okay, so we've got another question. So someone asked me, would you look to set up a private clinic in a pharmacy or a standalone clinic? In actual fact, I'm a firm believer now online, simply because you can scale it easier. And the advantage of online is once you understand search engine optimization, you get all that part right, it's straightforward. It's so easy. It is so easy to drive traffic there. It is so easy, but you have to understand this. So online, you can scale this. Having a face-to-face is extremely important because you can give value. And I was thinking of another idea, which I'll share with you, is what if pharmacists started to visit patients? Imagine that service, where you did a call-out service. I think that would do well. I think you can give value to patients. So yes, again, we can help you set things up from start to finish. We can guide you through. You can do that from start to finish. Absolutely. So someone's asked about our clinical entrepreneurship program. And he said, what do you cover in the clinical entrepreneurship program? The clinical entrepreneurship program teaches you everything about how to set up a business, how to run a business, all the way from knowing your writing a business plan to marketing strategy, social media strategy. We cover everything and we support you right till the end so you can set up your clinic. Right till the end. It's 6 months of live webinars and teaching, and we support you right till the end, right from start to finish. And you can do that with us. You can sign up. Works up to £1,000 a month, and it's over 6 months. And you have the content until you don't set this up. And we work with you on this from start to finish. Hey, Adil, fantastic to have you here. Thank you again, one of our students. There's so many of our students on these courses. I hope you've enjoyed the webinar. I'm about to go now.
I have one question.
Oh, you got a question?
Someone might have asked it. What qualifications would I need
Yeah.
to come on the courses?
Thank you very much. I love this question. Qualification. Okay. There's a difference in qualification. There's a difference in competence. If you're an independent prescriber, you have the qualification, you need the competence. If you're not a qualified independent prescriber, you should be developing your clinical skills now. Don't make the mistake that I made where you've got your qualification, but you can't use it. Develop your competency now. Understand how to take a history, understand the physical examination, understand diagnosis, management of disease, understand that. And also what we give you access to is our doctors at Medlearn. You will be spending time with our doctors at Medlearn so you can utilize the skill. We can help you become a non-medical prescriber. We can organize that for you. We can organize the teaching for you, and we can have you shadowing our doctors so you get the best out of your experience. So if you want to shadow our doctors, can be done. If you want help with becoming a non-medical prescriber, can be done. If you want to set up a clinic, can be done. If you want to make money, can be done. If you want to influence and build your personal brand, can be done. Tell us your problem and we'll solve it for you. And we'll be getting in touch, folks. So thank you very much for everyone. I really appreciate this. And, you know, it's fantastic. And again, Farzana, Dr. Farzana, great to have you here. It's wonderful to meet these people. I love all you guys. I'm going to have to love you and leave you. And we've got to get in touch. Thank you very much. Take care. And we'll meet up next week. Thank you, folks.
Thank you. Bye.